Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today I wanted to talk to you about gaps in your upper front teeth. You know you might have one, and if you have one, they're super frustrating, right? So if you have one, or if you're a doctor who has a patient who has one, we call those frenums. And let me show you a picture real quick. Hang on. So it looks like this. This is a maxillary labial frenum. The arrow is pointing right to it. Some people have a thick one, some people have a thin one, some people have a high one, some people have a low one. And if yours is thick and low, it might cause those front two teeth to gap apart. How frustrating is that? So it's really important that we talk about having that removed so that we can get a great orthodontic treatment. Hang on, I'm about to tell you more. All right, I'm back. Now that you've seen what a frenum looks like, let's talk about what we do about one. So if you have one like in the picture, it might be something that's forcing your teeth apart if it's low and thick, and it's something that you might be struggling to get corrected. Sometimes people end up having braces multiple times or aligners multiple times in order to get this treated, and it keeps coming back. And I know from personal experience, both as a doctor and as a patient who had one, it's very frustrating. So let's talk about what we do about it. Now, first of all, we need to identify it and make a plan. In general, what I do is I recommend as a doctor that you have that attachment severed or clipped. Not just a simple clipping though. You actually need to sever all the attachment down to the bone layer. It needs to be done by an oral surgeon or a periodontist preferably, but there are some general dentists who have experience doing it. I've always referred out to a specialist. Once you refer out, remember it's super critical that you don't do this at the beginning of treatment. You do it when your doctor recommends, at the end of treatment, once the space is fully closed, because if you do it too early, the scar tissue can force the muscle fibers, can force the space back open again with scar tissue, and we don't want that because it might be irreversible at that point. So listen to your doctor, and treatment timing is critical. But I recommend on the front end going to get a consult to find out how much this procedure would cost. Sometimes it's covered by insurance, but sometimes it's not. So it really depends on your insurance and on the doctor. Now there's two different ways this procedure is formed. One of them can be done with just a laser, and one of them can be done with a scalpel and sutures. I recommend asking around to make sure your doctor has a laser, because from experience, it's a way more comfortable experience and a procedure if you have the laser done. The traditional scalpel and sutures method is really quite uncomfortable. I can tell you from experience, my front lip looked like I'd been punched in the face for about a week. It was very painful. Maybe not everyone reacts like that, but it's really not that fun. So I do recommend the laser. It's going to be much more comfortable. Yes, you'll probably need to be numbed up, but swelling should be very minimal, and you probably won't need sutures afterwards. But I'm not a surgeon, so ask your surgeon if you have any questions. All right, that's pretty much it. I do recommend this procedure if you're a good candidate. That way you won't have to wear your retainer 24 hours the rest of your life. All right, take care. Don't hesitate to reach out, and please subscribe to our YouTube channel. Hit that little red button down below because we'd love to see your questions and engagement and comments. All right, take care.